everyone, welcome back to another good for you tip of the week. Today we're talking about vitamin B12. This is also known as methylcobalamin, and it is a water-soluble vitamin, and it plays a crucial role in various bodily functions. Hey everyone, I'm Dr. D, and welcome to my channel. Today's topic is vitamin B12. So B12 provides numerous health benefits due to its essential role in various physiological processes. In this video, we'll be discussing some of these health benefits of B12. B12 helps support red blood cells formations and prevents anemia. How it does this, it plays a vital role in producing red blood cells because without adequate B12, red blood cells can become large and irregular, leading to megaloblastic anemia, which causes fatigue and weakness. B12 also helps to boost our energy level. It's involved with converting food that we consume into glucose, which our body uses for energy. A deficiency can cause fatigue and low energy levels. So B12 also helps to promote brain health and reduce the risk of neurodegenerative diseases. It helps by maintaining the myelin sheath. That's the protective cover over the nerves. And it supports the proper functioning of the nervous system. Adequate B12 levels may lower the risk of conditions like dementia and Alzheimer's. B12 helps to improve mood and reduces depression symptoms. It's involved in the production of serotonin. Serotonin is this neurotransmitter that regulates our mood. So deficiencies have been linked to depression and mood disorders. B12 also helps to support heart health. It reduces the homocysteine levels. This is an amino acid that has been associated with the increased risk of heart disease. B12 contributes to better cardiovascular health. B12 also helps with healthy skin, hair, and nails. It supports the production and promotes healthy skin, reducing dryness and preventing brittle nails and hair loss. B12 can aid in fetal development during pregnancy. Adequate B12 levels are crucial during pregnancy to ensure proper development of the baby's brain and nervous system. A deficiency increases the risk of birth defects and premature birth. B12 supports bone health. So a B12 deficiency is associated with lower bone mineral density, which may increase the risk of osteoporosis. It also plays a critical role to improve cognitive performance. Healthy B12 levels can support memory concentration and overall cognitive function, especially in older adults. B12 assists in the DNA synthesis. It's essential for the production of DNA, which is the genetic material in our cells, making it vital for cellular repair and replication. So maintaining sufficient B12 levels through diet or supplementation ensures optimal health and prevents long-term complications. So let's talk about B12 deficiencies. It can lead to a wide range of symptoms, some of which may develop gradually and become severe if left untreated. Here are some common signs and symptoms to look out for. Fatigue and weakness, and this is caused by the reduced number of red blood cells produced, which will lead to decreased oxygen delivery to our tissues. A deficiency can cause pale or jaundiced skin, and it appears pale due to anemia, and a yellowish tinge can develop due to the breakdown of red blood cells. Deficiency can cause numbness and tingling, which is known as peripheral neuropathy. It affects the nerves, causing sensations of pins and needles, particularly in the hands and the feet. A deficiency can cause difficulty in walking or balance, And that's because damage to the nervous system can lead to coordination and movement issues, resulting in clumsiness or difficulty walking. Deficiency can lead to cognitive and memory issues. These are common symptoms that include forgetfulness, confusion, difficulty concentrating, which can progress to more severe cognitive impairments. B12 deficiency can lead to mood changes. It can cause depression, irritability, and mood swings, possibly due to its role in the serotonin production. It could lead to glossitis and mouth ulcers. Inflammation of the tongue is what glossitis means. It can become red, swollen, and painful. Mouth ulcers or burning sensation in the mouth may also occur. B12 deficiency can lead to shortness of breath and dizziness. Anemia due to B12 deficiency can cause reduced oxygen levels in our blood, leading to these symptoms especially during physical activity. A deficiency can lead to heart palpitations. The heart may beat irregularly and faster than usual to compensate for the low oxygen levels. B12 deficiency can lead to vision disturbances. Damages to the optic nerve can cause blurred or distorted vision. This is known as optic neuropathy. B12 deficiency can lead to high levels of homocysteine. B12 deficiency can elevate homocysteine levels, which may not produce symptoms initially, but may increase the risk of cardiovascular disease. So, who's most at risk for B12 deficiency? Well, they include vegans and vegetarians because B12 is primarily found in animal products. Older adults can be affected because reduced stomach acid and absorption issues are common with age. Other conditions can include people that suffer from Crohn's disease, celiac disease, or pernicious anemia, and those who use long-term medications such as metformin or proton pump inhibitors. So now let's talk about some sources of vitamin B12. B12 is primarily found in animal-based products, but they can also be found in fortified options and supplements for those who are plant-based. The best sources of vitamin B12 include animal-based sources such as liver and organ meat. Beef liver and lamb liver are some of the richest sources of vitamin B12. Shellfish like clams, mussels, and oysters. Fatty fish like salmon, tuna, sardines, and trout. Meat such as beef, chicken, and pork. Eggs, particularly in the yolks. And dairy products like milk, yogurt, and cheese. Now you can find B12 in fortified foods, ideal for vegans and vegetarians. These include options like cereals and plant-based milks. Fortified nutritional yeast is also a vegan-friendly option. And you can find B12 in B12 supplement tablets or capsules. They are available in the cyanocobalamin or methylcobalamin forms. You can do it sublingual, that means under the tongue, or you could do B12 injections, which are prescribed with those with severe deficiency and absorption issues. Other things to consider is fermented foods and seaweed. Some claim that these contain B12, but the type is not always bioavailable for humans. In probiotics, it may help improve gut health, but are not reliable B12 sources. Here are some tips for maximizing B12 absorption. Pair B12 rich foods with proteins for better uptake. In older adults, for those with absorption issues, they may benefit from supplements or injections. And vegans should focus on fortified foods and supplements since natural B12 is absent in plants. Incorporating these sources into your diet ensures adequate B12 levels to maintain energy, nerve health, and overall well-being. So now, what are the recommended dietary allowances known as RDA for vitamin B12? Well, this varies by age, gender, and life stage. Here are the general guidelines that have been provided by the National Institute of Health. For infants, which is 0 to 6 months, it's 0.4 micrograms. Infants 7 to 12 months, 0.5 micrograms. Children 1 to 3, 0.9 micrograms. Children 4 to 8, 1.2 micrograms. Children 9 to 13, 1.8 micrograms. Adolescent and adults of 14 years and older is 2.4 micrograms. Pregnant individuals, 2.6 micrograms. Lactating individuals, 2.8. Vegans and vegetarians, since they're plant-based diets, typically lack B12. So individuals following these diets may need fortified foods or supplements to meet the RDA. Older adults, people over 50 and have the reduced ability to absorb B12 from food due to decreased stomach acid production, may benefit from fortified foods or supplements. And those who have absorption issues, these are conditions like pernicious anemia, Crohn's disease, celiac disease, may require higher doses under medical supervision. B12 is water soluble, so the excess amounts are excreted through urine. However, very high doses should be taken only if recommended by your healthcare provider. If you do suspect you are deficient in B12, reach out to your healthcare provider. Thank you for watching this video. Don't forget to hit the like and subscribe button and leave in the comments what topic you'd like me to discuss in the next video. Thank you and make it a great day.